Most people have no idea, but the way you sleep tonight could quietly increase your stroke risk while you rest. One common sleeping position puts dangerous pressure on your blood flow, especially as you age. In the next few minutes, you'll discover the position doctors warn about and exactly how to fix it before it's too late. If you sleep on your right side, pay close attention. That position you're in right now, the one you think is comfortable, might be slowly restricting blood flow to your heart every single night. Here's what genuinely concerns me as a physician. Nearly a third of all strokes happen between midnight and AM, not during the day. Not during stress, but while you're asleep, defenseless, unaware anything is wrong. I'm Dr. Adrian Calloway, and welcome to Advanced Health. Over the next several minutes, I'll walk you through 5 sleep positions, ranked from bad to genuinely dangerous, and then give you 2 positions that could actually protect your brain starting tonight. Before we dive in, drop a comment below. Are you a back sleeper, a side sleeper, or a stomach sleeper? By the end of this video, you'll know exactly where your habit lands on this list. And if you're over 60, what I'm about to share isn't optional anymore. Before the list, let me talk to you directly for a moment, because this isn't just a video about sleep positions. You can eat well, exercise, take every medication exactly as prescribed, and yet for 7 or 8 hours every night, your body might be working against you in ways you've never considered. Maybe you're someone who wakes with a strange headache and shrugs it off. Maybe you're caring for a parent who mentions waking up dizzy. Maybe you simply want to protect your brain and heart for the next 20 or 30 years, not just today. Whoever you are, this is for you, and by the end you'll have something practical you can change tonight. Number 5. Sleeping completely flat on your back with zero elevation. It feels natural. Your spine is straight. Plenty of people swear by it. But here's what your body actually does when you lie fully horizontal, especially past 60. Blood pools toward your head. Gravity stops helping circulation and starts working against it. In your 20s, your vessels are flexible enough to handle this. After 60, they stiffen and the tiny arteries feeding your brain become more fragile. When blood pools in your head for 7 or 8 hours straight, pressure quietly builds inside your skull. That pounding headache some people get around AM, that's not random. That's intracranial pressure, your brain being squeezed by extra blood volume that isn't draining properly. Researchers in the Journal of Clinical Sleep Medicine found that even a modest 15-degree elevation of the head significantly reduces this pressure and improves blood flow back to the heart. Here's what most people miss: someone wakes up dizzy, sits up too fast, feels lightheaded, and thinks, I'm just getting older. Often that's actually a warning sign that blood flow dynamics during sleep aren't working correctly. I'll give you the fix at the end, but first, number 4, because it surprises almost everyone. Number 4. Sleeping on your right side, particularly with any history of heart issues or high blood pressure. Your heart sits slightly left of center in your chest. Lie on your right side, and your body weight shifts, gently compressing the inferior vena cava, one of the largest veins in your body, responsible for returning blood. From your lower body to your heart, even mild compression means your heart works harder to pull that blood back in. For a healthy 30-year-old, not a big deal. For someone over 60 with borderline heart function or high blood pressure, the heart is already working overtime. Add 7 extra hours of workload every night for years. Cardiologists notice this constantly. Patients with heart failure often instinctively avoid their right side. Because it feels wrong, that's the body sending a signal. Research in the European Journal of Heart Failure found left side sleeping was consistently associated with better blood flow stability and less overnight cardiac strain. Picture a patient I'll call Robert, a man in his late 60s who managed his blood pressure carefully for years. Medications stable, labs fine, but every night, without realizing it, he slept on his right side. No dramatic daily symptoms, just a heart quietly compensating, working harder than it should, year after year. That kind of cumulative stress doesn't show up on a daytime blood pressure reading. Sometimes it shows up instead as a stroke at AM. If you commented right side sleeper, stay with me because number 3 might apply to you too. Number 3. Stacking 2, 3, or 4 pillows under your head. People do this for breathing, reflux, or sinus drainage, and some elevation genuinely helps. But excessive elevation bends your neck forward dramatically. Running along your cervical spine are the vertebral arteries, supplying your brain stem and cerebellum, the regions controlling balance, coordination, and consciousness. Push your head too far forward with stacked pillows, and these arteries can become compressed. You won't feel it in the moment, but chronic compression over months and years can reduce oxygen delivery to vital brain regions. That stiff neck and dull ache at the base of your skull most mornings? Often that's restricted blood flow, not just muscle tension. Research in the Journal of Manipulative and Physiological Therapeutics found extreme forward neck bending measurably reduces vertebral artery flow. That study wasn't about sleep specifically, but the principle carries over 8 hours in a compromised position, night after night, adds up. I see this constantly. Someone assumes their morning headaches are stress or age, switches to one properly contoured pillow, and within a week the symptoms disappear. One pillow, but we're only at number 3. Number 2. Sleeping in a tightly curled fetal position. Common, especially among older adults, and it feels protective and instinctive. But physiologically it creates 2 problems. First, your lungs can't fully expand. Knees to chest, chin tucked, your rib cage compresses, and every breath all night is shallower than it should be. That tight-chested feeling when you wake and can't take a deep breath right away? Your lungs have been restricted for hours. Drop oxygen intake by even 10 or 15%, and blood oxygen saturation falls with it, stressing the heart and brain in anyone with cardiovascular issues or early lung disease. Second, your neck and upper back stay under constant tension, muscles contracted, small vessels around the cervical spine and skull base compressed, blood flow to the brain reduced. Research in respiratory physiology shows spinal flexion reduces tidal volume, the air you inhale per breath, and over a full night that's hundreds of shallow breaths. Someone wakes foggy, with a dull headache, a little dizzy, and thinks, I slept poorly. In reality, the brain may have been mildly oxygen deprived for hours. The fix is simple, and I'll show you at the end. First though, number 1, because it combines multiple risk factors into one dangerous nightly routine, and if it's you, consider stopping tonight. Number 1. Going to bed within 2 hours of a large meal or alcohol. Evening dinners, a glass of wine, it's part of life, but cardiovascularly this is the most dangerous item on the list. When you eat a large meal, your body redirects blood to digestion, which is normal, but it means less blood is temporarily available for your brain and heart. Younger bodies compensate easily. Older adults with narrowed arteries can experience dizziness or even fainting during sleep as a result. Add alcohol, which dilates blood vessels and drops blood pressure suddenly. For healthy, flexible vessels, that just feels relaxing. For stiffened arteries with plaque buildup, the sudden drop triggers a compensatory spike, then another drop, wild fluctuations that stress vascular walls, weaken vessels, and can even cause rupture. In areas where flow turns erratic, clots can form, all while you're unconscious. Research in the American Journal of Hypertension found even moderate alcohol close to bedtime disrupts the normal nighttime blood pressure dip, dramatically increasing cardiovascular strain. Picture this. Dinner at p.m., 2 glasses of wine, bed by 10. At a.m., pounding headache, racing heart, sweating. Bad dream, they think. More likely, that's a circulatory event the body is compensating for. These episodes accumulate quietly, small vessel damage, tiny strokes too minor to notice, until one night it isn't minor anymore. If you take one thing from this video, finish dinner 3 hours before bed, stop alcohol for 5 hours before sleep, and take a short walk afterward. This single change can reduce overnight stroke risk more than many medications. Now, what to do instead? First, left side sleeping. Since your heart's it's slightly left of center, sleeping on your left lets gravity assist blood flow instead of fighting it. Less cardiac work, better circulation, more consistent oxygen to the brain. But here's what changes the conversation entirely. About a decade ago, researchers identified the glymphatic system, your brain's waste disposal network, which flushes out toxins and proteins linked to Alzheimer's while you sleep. A study in the Journal of Neuroscience found this clearance works most efficiently during side sleeping, particularly on the left. Every day your brain accumulates proteins like amyloid beta and tau. In Alzheimer's, these build into plaques. Healthy brains clear much of this during sleep, but a restrictive sleep position slows that clearance, and those proteins can accumulate across decades, with damage often done by the time symptoms appear. Left side sleeping helps optimize that nightly clearance, protecting cognition decades from now, not just stroke risk tonight. It also helps keep stomach acid down for reflux sufferers. If you've slept on your right side or back for 30 years, this takes adjustment. A body pillow, hugged in front of you, helps keep you positioned left and supports your spine. Add a smaller pillow between the knees for joint pain. Worried about rolling over? You will, and that's normal. The goal isn't perfection, just spending more time in the healthy position than the harmful one. A second option works well for specific people. Back sleeping with gentle elevation, not flat and not fully upright, but a 15 to 30 degree incline across your entire upper body, using a wedge pillow, adjustable bed, or stacked pillows. This helps for 3 reasons. Blood returns more efficiently from the lower body, easing strain for anyone with poor circulation or varicose veins. Pressure inside the skull decreases, reducing the risk of small vessel rupture in people with fragile brain vessels or uncontrolled blood pressure. And breathing improves, with a more open airway that can ease mild sleep apnea or congestion. One detail most people miss: if you elevate your upper body, place a small pillow under your knees too, maintaining your spine's natural curve. NASA studied this exact combination, sometimes called zero-gravity posture, for astronauts, and it distributes pressure evenly while easing strain on joints and vessels. This isn't one size fits all. Though, severe sleep apnea can still collapse the airway even with elevation, so left-side sleeping is often better there. Shoulder arthritis may respond well to elevated back sleeping. Heart failure usually favors the left side. Understand why each position works, then apply it to your situation. Which have you tried, left side or elevated back? Let me know in the comments. Your bedroom environment matters too, because even the perfect position won't help if these factors work against you. Keep your room between roughly 64 and 68 degrees Fahrenheit. A cooler environment drops your core temperature, deepens sleep, and naturally lowers nighttime blood pressure. A room that's too warm keeps you in lighter sleep stages with an elevated heart rate, and you never reach the deep recovery phase where real healing happens. Cut blue light after around p.m. Phones, tablets, and harsh overhead lights suppress melatonin and delay the deep sleep stages where your brain clears metabolic waste and your cardiovascular system stabilizes. Use night mode or blue light blocking glasses if you must use a device, or better, pick up a physical book. Proper neck support matters too, as we covered earlier. A contoured pillow supporting your cervical curve helps prevent restricted blood flow through the vertebral arteries. And consider noise. Sounds that don't fully wake you still jolt you out of deep sleep, spiking heart rate and cortisol in micro-stress events you won't remember, but your vascular system will. A white noise machine or earplugs can mask irregular disruptions. If you want to go further, track your nighttime health. An overnight pulse oximeter clips on your finger and tracks oxygen levels. Repeated drops below 92% are worth flagging to your doctor, potentially pointing to sleep apnea, poor circulation, or a respiratory issue. Heart rate variability tracking via smartwatch or sleep ring reflects how well your autonomic nervous system is functioning. Low overnight HRV can signal stress, inflammation, or metabolic dysfunction. A simple sleep journal noting morning headaches, dizziness, numbness, or brain fog can reveal patterns your doctor would otherwise never see. These tools are for awareness and education, not diagnosis, and they never replace professional care, but they replace guessing with measuring. Here's why you rarely hear any of this from your own doctor: sleep position doesn't fit neatly into a 15-minute appointment focused on labs, medications, and acute symptoms. But research increasingly shows that your sleep position silently affects blood flow, oxygen delivery, pressure inside your skull, and your brain's ability to clear toxic proteins, cumulative processes building night after night, year after year. For anyone over 60 or managing blood pressure or cardiovascular conditions, these habits become genuinely critical. Here's the encouraging part: you don't need a prescription. You need awareness and 1 or 2 targeted adjustments. Shift toward left side sleeping. Elevate your head 15 degrees. Stop eating within 2 hours of bedtime. Swap 3 stacked pillows for 1 contoured one. Any single change can measurably improve how your cardiovascular system functions during sleep, protecting brain longevity and cardiovascular health for decades, not just tonight. By watching this video, you're already more informed than the vast majority of people. You're taking control of variables genuinely within your power. So here's what I'd like you to do today. Pick one adjustment from everything we covered and give it 7 days. Notice whether headaches decrease, whether energy improves, whether you feel sharper. Your body will tell you if it's working. Drop a comment and tell me which habit you're changing first. Your answer might help someone else recognize a pattern they hadn't considered. If this video gave you information you'd never heard before, hit that like button and share it with someone who needs it, someone over 60, someone managing blood pressure, someone who keeps waking with unexplained symptoms. And subscribe to Advanced Health right now, because next week I'm covering 5 specific foods that clinical research shows may help reduce stroke risk by up to 30%. Not vague advice, specific foods in specific amounts. You probably already have 3 of them in your kitchen, you're just not using them correctly. Hit subscribe. Turn on notifications, because if today mattered to you, next week will matter even more. Until then, sleep smart, stay informed, and protect that brain of yours. I'm Dr. Adrian Calloway, and I'll see you in the next one.